Rotator cuff injuries, like most orthopedic conditions, tend to progress over time when they are ignored. What may begin as a simple tendon impingement, irritation, or tendinitis can eventually progress into a partial tear or even a full thickness tear. Unfortunately, many people wait too long to address shoulder pain before seeking treatment. The good news is that the rotator cuff often improves very well with physical therapy, but improvement is usually gradual and requires consistency. In cases of tendinitis or shoulder impingement, physical therapy can often completely resolve symptoms. The initial goal is to restore mobility and improve blood flow to the tendon through gentle, controlled exercise. This helps reduce inflammation and irritation within the rotator cuff and allows the tissue to begin healing more effectively. In cases of partial tears, physical therapy works a little differently. We cannot reattach the torn portion of the tendon back to the bone through exercise alone. However, that does not mean the shoulder cannot function extremely well. The first goal is to improve mobility and reduce pain and inflammation around the shoulder. From there, the focus shifts towards strengthening the rotator cuff and the surrounding shoulder muscles to improve stability, control, and overall function. The goal is that even though the tear may still exist structurally, the shoulder becomes strong, stable, and functional enough that you no longer experience significant pain or limitation from it. It is also important to understand that this process takes patience and consistency. The number one question I get from patients in clinic is, how long will this take to get better? The honest answer is it depends on your situation. The healing timeline for a tendon injury is anywhere from 3 weeks to 12 months. It is incredibly variable because everyone's condition is unique in its severity and presentation. Healing is dictated by a combination of factors, including severity, genetics, if you are allowing it to heal by avoiding aggravating activities, and if you are being consistent with your PT. All of these factors affect how quickly someone improves, which is why two people with seemingly similar conditions may recover at different rates. Most people begin noticing improvements in pain and mobility within about 2 to 4 weeks of consistent physical therapy. More meaningful strength gains and long-term tissue adaptation often begin around 4 to 6 weeks, and sometimes longer depending on the severity of the injury. As a clinician, I personally try not to focus too heavily on exact healing timelines because not everyone follows the standard timeline, and that is completely normal. Sometimes rigid timelines can make patients feel like something is wrong if they are not better by a certain point, when in reality, some people simply take longer to heal. So if progress feels gradual at first, that is completely normal and expected. Try not to get discouraged if your recovery is taking longer than anticipated. These injuries often require time, patience, and consistency to fully improve. Next, we'll discuss what not to do with rotator cuff injuries, because this is often where people unintentionally slow down their recovery and stop making progress.